team of physicians first meet with the Commissioner for Health to intimate him on the rising hemophilia disease that has killed many Nigerians knowingly or unknowingly due to non-availability of diagnostic centers. Ahead of its setting up, about 50 laboratory scientists and attendants, doctors, nurses are also being trained about the symptoms and diagnosis of the disease.
Hemophilia Foundation of Nigeria is a non-profit organization that advocates for persons with inherited bleeding disorders. We have been working with different states and the federal government for the past 20 years. We're trying to set up our hemophilia treatment center in Yobe state and to also work with the state in trying to identify more patients that have these conditions. So we're talking of over 2 million Nigerians who also have von Willebrand's disease. So the disease burden is about 3 million Nigerians who have this condition, but we are yet to identify even up to 1,000 in our records.
There are other inherited blood disorders like hemophilia, thalassemia, and other things. So now we think that there is a lot of gap in terms of a diagnosis. We don't have much accessibility for diagnostic centers and equipment, and also patients, they are underdiagnosed with such kind of condition from the community. So as such, we try to see that we collaborate with the Yobe State government, more especially the Ministry of Health, and then the Yobe State Teaching Hospital.
The Yobe State's Commissioner for Health explains that the diagnostic center will limit the long-distance travel of patients suffering from the disease and the lack of access to services.
Establishing this center will bring diagnostics and management of hemophilia as close to the people as possible. And that additional center will go a long way in, reducing the cost of travel risks that are associated with it and so on and so forth. Access to the medications, as we just had, these medications are quite expensive.
The coming of this Hemophilia Foundation, as well as the Sickle Cell Eradication Initiative, for them to establish a center in Yobe State is definitely in recognition of the massive investment and the progress made in healthcare delivery in this state. The Yobe State University Teaching Hospital has been in the forefront and the apical referral center in this state. We have shown commitment and we have provided the necessary steps in which they can build on and develop the sickle cell and the hemophilia center in this state.
The Yobe State House of Assembly has already passed the law for the compulsory genotype screening for all intending couples. It is believed having the hemophilia screening center would also lessen burden faced by the patients.